Delhi Super Specialty Hospital. And here with me today we have Dr. Kapil Kumar and Dr. Ashish Goel, who are going to speak to us about cancer awareness and answer all the questions that are coming in on the laptop right now. But before we begin, can we get a few introductions for both of you? Dr. Kapil Kumar first.
I'm Dr. Kapil Kumar. I'm director of the BLK Cancer Center and overlooking surgical oncology, medical and radiation oncology. And we have a comprehensive cancer center where we do surgical oncology comprising breast cancer, head and neck cancer, GI cancers, gynae oncology cancers, and apart from that, we do plastic and reconstruction. Recently, we have started doing high-tech surgery also for peritoneal diseases, and we do preventive work as well as we advise patient about genetic counseling as well.
Right. And Dr. Ashish Goel.
I'm a surgical oncologist. I'm trained from Rajiv Cancer Institute in Mahavir Cancer. I'm diplomat in National Board of Surgical Oncology, working here as a senior consultant. I'm more into breast, thoracic, and head and neck cancers.
So let's begin with our questions. The first question is from Mamta Agarwal. She asks, it was said that if we get the biopsy done, then it will lead to growth of cell in a multiplier form.
This is a myth which we want to break with all the people who come across such queries. There is no spread as far as cancer is concerned by doing either needle testing or doing a biopsy. So there is no, this is a myth.
And in fact, it's mandatory to.
But it is mandatory to do biopsy and FNAC before starting the treatment for cancer.
The type of cancer and what requires to be followed.
The second question is from Kapil Kumar. He asks, does sugar really feed cancer cells?
Yeah, Praveen, I don't think there is any data to say that cancer is more common in diabetics or something like that. So cancer, it's itself an abnormal growth of cells. It occurs on its own, maybe some genetics or maybe some reasons related to your lifestyle and diet. As such, diabetes and cancer has no correlation.
The next question is again from Mamta Agarwal. She asks, can cancer lead to other big complications?
Cancer itself is very heterogeneous and it can present in many stages. If it is in early stages, then most of the time the patient remains in good general condition. But as the cancer progresses, then the complications can occur depending upon where the disease happens, and it can press upon major vessels or major organs. Then there can be obstruction, or there can be a pain due to any. Suppose there is a disease deposit in the spine, then the patient can have pain, or if it is obstructing the intestine, then patient can have an intestinal obstruction. The patient can have major complications due to cancer itself.
Especially if it's neglected, the treatment is neglected in early stage. Some patients can come with complications.
Next question is from Kanika Kanwar. She asks, what causes any form of cancer in general?
But cancer is an abnormal growth of cells. So it's that the incidence is increasing, and probably because of urbanization, industrialization, and more elderly population being there, more and more population increasing. So as such, there is no very well defined ecological factors except for say tobacco, alcohol, and smoking. Other factors are risk factors, but it's just abnormal cells.
Some of the risk factors can be the obesity, and increase
Diet,
increase normal cholesterols and this, junk food and obesity, which can lead to, because the obesity itself can lead to storage of hormones in the body, and that itself can lead to cancers.
I think the next question is along the same lines, but Arushi Vijay is asking, what should be my lifestyle to prevent cancer?
so as of now, as we say for other diseases also, you should have a healthy lifestyle, do a regular exercise and avoid junk food, healthy food in terms of cooked veggies and fresh fruits,
Reasonable body weight.
antioxidants,
Body weight should
reduce
be
body weight. All these things would help. Avoid hormone replacement, some medication.
avoid alcohol, smoking.
Alcohol, smoking, and tobacco certainly and all.
Kaushik Banerjee asks, are there any societies or groups providing help for cancer patients?
There are support groups for which can help survivors, and some agencies are there, NGOs who can help in treatment of patients.
Like We Care and Cancer Care, and surprisingly, most of them are run by cancer survivors. They are themselves cancer survivors, and they also, in some situations, help poor patients finance their treatment. There's also a support group for children, that is pediatric cancers. So they look after these kids.
The next question is from Arushi Vijay again. She asks, what are the do's and don'ts during chemotherapy?
During chemotherapy, most of the dictum is that we don't eat uh, uh, raw vegetables and fruits, and we eat mostly cooked foods, so that the chances of infection are less, and have a limited physical activity during that period, because there is extreme weakness during that period, so that should be taken care of.
Um, the next question is from Parvesh Agarwal. He asks, what is your opinion on stem cell transplantation treatment and is it successful or not?
Stem cell transplant is mainly for hematological disorders, and it's a separate specialty. We have in our hospital hemato-oncology department, which looks after this stem cell division, and we are doing uh, bone marrow transplant and also the stem cell treatments for that.
The next question is from Riddhi Jain. She asks, how long do side effects of chemotherapy last?
There are some short-term side effects which can last for a few days to few weeks, but there can be some long-term side effects of chemotherapy which can last for a few years. Like patient can have some uh, physical weakness for some 2 to 3 years, or even after completing chemotherapy.
So most of the people are worried about the initial short-term side effects in terms of nausea, vomiting, loss of weight, and important is loss of hair. But all that is temporary. I think by 2 3 months, once the chemo is over, most of the hair come back, and sometimes you can't even you see the patient, you can't realize that she has a newborn. All that. Most of them do revert. It should never be a concern when somebody is prescribed.
The next question is from Parag Aswal. He asks, am I more likely to have cancer if I have a family history?
So overall, say less than 5% of cancers are hereditary. But generally, it's a myth that if my parents had cancers, I'm also going to have cancer. For example, you may have a higher risk of developing prostate cancer or maybe breast cancer, especially if you're that two or more than two relatives in the same family had a cancer. So for a young lady, probably the mother's sister or sister, if two of them had a cancer, there may be chance of it being hereditary. But nowadays there are tests available, so you can actually look at your gene setup and then see whether you are at high risk or not. In case you are negative for the gene, then certainly there is no risk. Yes.
If there are no abnormal gene, then the risk of developing cancer is like any normal population. But if the gene is there, then the chances of developing few cancers like breast cancer, or colon, or prostate are there, or ovary, in these patients who have abnormal genes.
Parag Aswal also has one more question. He says, just a second. What tests can be done to diagnose cancer early?
Very difficult for to prescribe tests in a asymptomatic healthy person, but definitely we can examine certain areas, like we can examine the oral cavity, we can physically examine the patient, ask about symptoms, and rule out a few cancers by do a routine testing like chest X-ray, ultrasound, and one physical examination. and pap smear in females and doing mammography in patients who require mammography screening. There we can identify some cancers. But as such, to prescribe a few tests to identify cancer in asymptomatic patients is very, very difficult.
So basically, no one test fit all right now. But maybe mammography for women more than 40 years and a PAPS test for women more than 25. It should be a norm. It is there as a normal screening protocol abroad, but not very commonly done in India.
The next question is from Kanika Kanwar. She asks, what are breast cancer's main causes?
The first and foremost risk factor of breast cancer is being a woman, but most of the breast cancers occur in women. And other related risk factors may be obesity, diet pattern, taking oral contraceptives, and early age at onset of your menstrual history, late menopause, and in some cases, late child bearing the child at a later age, at more than 30 years, or not having any children at all. These situations are additional risk factors. I don't mean to say that you'll be more likely to get cancer if these are there, but your risk increases.
The next question is from Kapil Kumar. He asked, does cigarette smoke, even if the intake is indirect, really cause cancer?
Indirect.
Does cigarette smoke, even if the intake is indirect, can it cause
Yes,
cancer?
it's a well-known fact that it's known as secondary smoke or passive smoke. So if the husband is smoking, or certainly the wife sitting across the table is at a higher risk. So that is known as passive smoke. The amount is less, but they are at a higher risk. Even young kids in the family, they are also at a high risk of getting not cancer, but maybe diseases due to the smoke.
The next question is from Jiddy Jain. She asks, do the families of cancer patients get financial help for the treatment?
I would suggest that most of the Indian population should take insurance for health, and which most of them are not doing, and that should be the way forward for taking the treatment in cancer, rather than depending upon any financial NGO or any financial institution who gives help. We should help ourselves by insuring ourselves.
The next question is from Chandni Goel. She asks, what are the alternative remedies that can help in dealing with cancer?
We are a evidence-based medicine which we are doing when we employ surgery, medical oncology treatment, chemotherapy, hormones, and targeted treatment plus radiation. And apart from that, we are not aware that I don't have much knowledge about alternative treatments like Ayurvedic or homeopathic. I'm not aware that these have any scientific evidence to treat and cure cancers.
She has another question. She asks, how do you know if you have mouth cancer?
Mouth is very easily examined by any doctor, and you can find if there is ulcer in the tongue, oral cavity, which is or a sore which is not healing in the throat, and there is a difficulty in eating. There is a foul smell, or ulcer which does not heal for more than 3 weeks. That should be taken care of.
Any unexpected loosening of teeth.
So that is where you should undertake or any lump in the neck is there, and there you can always, or bleeding through the mouth is there. That should be taken care of and consulted.
We have another question from Kavita Gupta. She asks, how can I help my friend who is suffering from cancer cope with emotional and physical stress during and after treatment?
I think the more important thing is to counsel the patient that all's going to be well, and it's not the cancer word these days is taken as a big moment. No, I can't be a survivor. And it's not like that. It's a myth. Earlier, people used to think that cancer is not curable. So most of the curable cancers are curable, and you can have a good quality of life with complete treatment. You need to counsel her that things are going to be right, and all these side effects, whatever are occurring, are more or less temporary. It's going to be.
I think counselor in the hospital plus some psychological help from the counselors plus family support that is important in coping up with the cancer.
While we wait for more questions to come in, is there anything else you'd like to add? Any tips that you'd like to give people who are probably diagnosed or maybe unaware that they could be?
Actually, there are some warning signs of cancer. So, as such, the cancer can affect any part of the body, any organ, almost every organ. But there is no specific symptom to differentiate a cancer disease from non-cancer. But still, there are some certain warning signs in terms of any non-healing ulcers or cavities in the mouth, any unexplained cough, fever, blood in the sputum, blood in the vomiters, any irregularity in the urination or the passing stool, any other lumps in the body, lumps in the breast, any change in voice. These are affecting the body. If somebody has a mole and the mole is increasing in size or maybe itching or bleeding. So in these situations, you must consult your doctor.
I think is if you have some symptom, say cough, which is not improving with the normal treatment for say more than 2 or 3 weeks, then suspicion should be there, and patient should have a revisit or another opinion from another specialist, so that diagnosis of cancer, if at all suspicious is there, should be made.
It should not be missed out and just labeled as an infection or a tuberculosis.
Yeah, most of the time, tuberculosis infection are taken granted, and like changes in the chest X-ray or chronic cough, which is persisting for more than 3 weeks, is not diagnosed, and patient sometimes is put on tuberculosis treatment, and diagnosis of cancer is missed. So any symptom which is there for more than 2 or 3 weeks should have a revisit for the and make a diagnosis, so that the cancer is not missed.
And from the news and what we hear that there's so many chances of survival, that there's more in advances in medical sciences that chances of survival are more. How do we implement that? What if there are patients who are in a late stage of cancer? Are there still chances that they can survive?
See, if a patient comes in stage 1 or maybe early stage 2, then the chances of survival are higher. Cost of treatment also become less, and the visit to the hospital and revisits or follow-up are also less for these patients. The patient who come in stage 3 and 4, they need more treatment, they need um, more investigation, more treatments, more expenses, and more visits to the hospital. So it is the stage which determines the outcome of the patient.
Um, Many a case, sometimes it happens that patients aren't comfortable with the doctor, so they spend maybe waste a lot of time in searching for the right doctor. So how do patients know that?
Patient should go where there is a high volume center, and there are specialists for a particular, you know, uh, they should not, they should go to cancer centers, basically whichever, either cancer hospitals or cancer centers, where specialists are there to treat cancer and also advise them about surgical treatment, medical treatment, and radiation treatment, and also the palliative treatment or supportive treatment.
We have a multi-specialty tumor board in our hospital, and most of our patients go through the tumor board. So, in the presence of the medical oncologist, radiation oncologist, the radiology, pathology, so all cases are discussed there, and a consensus as to the treatment plan is made. So that should be the focus, so that opinion of all the entire disease management group is taken before a treatment plan is made. That will be evidence-based management.
There is also a rise in children getting affected with cancer. So what is this number of children that you see nowadays getting affected with cancer? What tips would you give children to protect themselves in a way, or parents in that matter?
The cancer which occur in children are a different set of tumors. They are not the same kind, but they are still curable, especially if they are caught at the early stage. So for children also it's the same thing, that obesity and diet and all these things, lifestyle, they should play games, but these things should also have some role. And in case children have cancer, most of them are curable. They also have to go to the same things like chemotherapy, surgery, But the main issue in pediatric cancer is some of them may have some long-term sequelae, but these children are going to grow up into adults. So sometimes these sequelae are important, and when they're treated, they, this aspect has also to be taken into consideration.
Most of the cancer in childhood are curable.
Most of them.
So for a patient who is in a very probably early diagnosis, what will be the stages that the patient has to go through for treatment?
First of all, we have to make a diagnosis of cancer, which can be done by either by needle testing or a true cut biopsy. Or patient may have to undergo scans, or maybe some special blood test, some endoscopies, and sometime CT scans, MRs, mammographies, or maybe a PET scan may be required in some cases. And then once a diagnosis is made, and then a treatment plan can be chalked out for that patient by consultation amongst surgery, medical, and radiation oncologists in a tumor board setting, and there how you can have a plan for treatment.
We have a question from Arushi Vijay. She asks, why does the diagnosis seem to be so delayed in many cases?
It is because of lack of suspicion on the part of patient, as well as sometimes the primary physicians, that they don't suspect that a 26-year-old girl or a boy or a child can have a cancer. So it is the awareness on the part of physician as well as, and uh, that sometimes treatment diagnosis can be delayed.
Sometimes the delay is because of the philosophy of the general people that I can't have it, because they become late because they feel that I can't get it. I can't get cancer. So they don't go to the right person. There's a feeling of denial, so they keep on taking alternative treatments. And they're looking for people who tell them that no, you are okay. That philosophy has to change.
What about, I think, the most general person type of category people, smokers? So smokers who are trying to quit, do they still have a risk of falling prey to cancer?
So the risk of developing, say, lung cancer per se decreases if the person quits smoking. But if you compare to ever smokers versus never smokers who have quit, the relative risk does go down with every year, but it still doesn't come to zero. So I would say that, but you should quit smoking at the earliest moment. So the risk will come down. I don't say that now you have quit smoking, so you won't develop cancer. Same thing is for tobacco chewers.
What about, so if you maintain, say, a case example, if a person is very, very physically active, sports and everything, yet still indulges in, say, smoking or things that can be dangerous to their health, what about for those type of people?
The general public does not realize the harmful effects of smoking. Besides developing cardiac illnesses, lung illnesses, a lot more of cancers are related to smoking, such as the throat cancer, mouth cancer, food pipe, lungs, even the urinary bladder cancer is related to smoking. So it almost affects the whole body. So quitting smoking
Is very important.
very important.
Any other precautionary lifestyle changes that you would suggest to people to make at this stage? And maybe we can direct this to the youth, say 20 to 30 years.
Avoid smoking altogether and tobacco products, alcohol. Avoid alcohol and maybe taken in moderation, and keep the weight in check. That's what is important.
Any last things that you would like to add to people watching?
Very important thing is awareness. We have to be aware about cancer. You need to fear, but you have to be aware of your body, aware of your surroundings. And for the slightest suspicion, you must consult the doctor and maintain a healthy lifestyle.
Anything that you would like to add?
Thank you. Thank you.
Thank you.
The 15 question हो गए मतलब